Hello and welcome. Today, we're diving into a critical yet often overlooked condition affecting the digestive system, ischemic enteritis. We'll explore what it is, why it happens, how to recognize it, and what can be done to manage it. So, let's get started on understanding this complex disease. Ischemic enteritis, at its core, is all about blood flow, or rather, the lack of it. The primary cause is a reduction or blockage of blood supply to the small intestine. This can stem from various factors. Atherosclerosis, or the hardening of the arteries, is a major culprit, narrowing the vessels that feed the intestines. Blood clots, whether originating in the heart or forming locally in the intestinal arteries, can also abruptly halt blood flow. Other contributing conditions include low blood pressure from shock or heart failure, certain medications that constrict blood vessels, and even physical factors like bowel obstruction or hernias that can compress the arteries. Now, let's delve into the nitty-gritty of what happens inside when blood flow is compromised. When the small intestine is deprived of oxygen-rich blood, a cascade of events unfolds. Initially, the intestinal cells suffer from a lack of oxygen and nutrients, leading to cellular damage and dysfunction. If the ischemia persists, the intestinal lining becomes inflamed and weakened, making it susceptible to ulceration and bleeding. In severe cases, the tissue can actually die, leading to intestinal necrosis and potentially life-threatening complications like perforation and sepsis. Ischemic enteritis isn't as common as other digestive disorders, but it's certainly not rare. It predominantly affects older adults, particularly those with pre-existing cardiovascular disease, diabetes, or a history of smoking. People who have undergone major abdominal surgery or have certain blood clotting disorders are also at increased risk. Due to varying diagnostic criteria and underreporting, precise figures on its incidence and prevalence are challenging to obtain, but it's a condition that clinicians must keep in mind, especially in susceptible populations. Recognizing the signs and symptoms is key to early diagnosis and intervention. Patients may experience sudden and severe abdominal pain, often described as cramping or colicky. This pain is often disproportionate to the physical examination findings, meaning the abdomen might not seem as tender as the level of pain would suggest. Other common symptoms include nausea, vomiting, diarrhea, and the presence of blood in the stool. In chronic cases, the symptoms may be more subtle, such as postprandial abdominal pain, that is, pain that occurs after eating, leading to food aversion and weight loss. If you experience any of these symptoms, particularly if you're in a higher risk group, seeking medical attention promptly is crucial. Diagnosing ischemic enteritis often involves a combination of clinical suspicion and diagnostic testing. Because the symptoms can mimic other abdominal conditions, a detailed medical history and thorough physical examination are essential. Blood tests can help identify elevated white blood cell counts, indicating inflammation or infection, and markers of tissue damage. However, imaging studies play a vital role in confirming the diagnosis. CT angiography, which uses contrast dye to visualize the blood vessels, is often the preferred method for identifying blockages or narrowing of the intestinal arteries. In some cases, colonoscopy or exploratory surgery may be necessary to directly visualize the intestinal lining and obtain tissue samples for biopsy. While the overall umbrella term is ischemic enteritis, it can be further categorized based on the severity and duration of the blood flow restriction. Acute ischemic enteritis refers to a sudden and severe interruption of blood supply, often leading to rapid tissue damage. Chronic ischemic enteritis, on the other hand, involves a more gradual reduction in blood flow, resulting in intermittent symptoms and potentially long-term complications. Additionally, the location of the affected blood vessels can further classify the condition, such as superior mesenteric artery ischemia or celiac artery ischemia, depending on which major artery is involved. Treatment for ischemic enteritis hinges on restoring blood flow to the affected area and preventing further complications. In acute cases, immediate hospitalization is necessary. Initial management focuses on stabilizing the patient with intravenous fluids and pain medication. If a blood clot is the culprit, medications to dissolve the clot or surgical removal may be necessary. For severe cases with intestinal necrosis, surgical resection of the damaged bowel is often required. In chronic cases, lifestyle modifications, such as quitting smoking and managing underlying cardiovascular risk factors, are important. Angioplasty and stenting, procedures to widen narrowed arteries, may also be considered to improve blood flow. Preventing ischemic enteritis largely involves managing underlying risk factors. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, is crucial for promoting cardiovascular health. Controlling blood pressure, cholesterol, and blood sugar levels can also reduce the risk of atherosclerosis. If you have a history of blood clots Working with your doctor to manage your condition with appropriate medications can help prevent future events. Furthermore, being aware of the symptoms and seeking prompt medical attention if you experience abdominal pain, especially if you are at higher risk, can lead to earlier diagnosis and treatment, improving outcomes. The prognosis for ischemic enteritis varies significantly depending on the severity of the condition, the promptness of diagnosis and treatment, and the overall health of the patient. Early diagnosis and intervention can improve outcomes and reduce the risk of complications. However, in cases of severe intestinal necrosis, the mortality rate can be high. Recent research is focused on developing new diagnostic techniques, such as advanced imaging modalities, to detect ischemia earlier. Researchers are also exploring potential therapies to protect the intestinal lining from ischemic damage and improve outcomes for patients with this challenging condition. Thank you for joining us as we explored ischemic enteritis. Remember, knowledge is power when it comes to your health, and stay informed.